was it? Yes.
Yeah, I won't name his name because he's a patient. So
Story. No, yeah.
okay.
Protect their name and their identity. But we want to hear those success stories. This is an amazing topic, Tommy.
Yes.
I'm so glad we met. So
Me
we
too.
are live. Hello, Facebook world. I am Kim Martin, host of Healthy You Today, and we are coming at you live as we do every Wednesday. Normally, we come on a little earlier than this. We usually come on live around 8:30. But we had a little disruption this morning. One of my children has strep throat, so we've been at the doctor's office all morning and had to kind of push this out today. But I did not want to cancel this show, Tommy, because you guys don't want to miss this. Be sure to show us some love. Start sharing this show. Encourage your friends to tune in and watch, because we are going to be talking all about sleep, specifically sleep apnea. So
Yes.
not getting enough sleep and what that does for you. And it impacts your health immensely. Okay, so this is going to be a great show today, even though we're coming at you a little bit late. You may be watching it later, so this might be pre-recorded when you're watching it. That's okay. Please share and encourage folks to tune in and watch this show. So my guest today is the awesome Tommy Hinton. Hey, Tommy.
Hi, how you doing? Thank you for having
Good.
me.
And our paths crossed maybe what now, 5 or 6 weeks ago?
Yeah.
And you started sharing with me your passion about sleep apnea. You work for a doctor in Morton.
Yes.
And you guys are helping people get some assistance when it comes to sleep apnea.
Yes,
So why
absolutely.
don't we just dive right in? What is sleep apnea?
So what sleep apnea is, it's categorized as multiple pauses in your breathing, while you're sleeping.
Okay.
And when you're doing that, you're causing a lot of issues in your body. So what's called an apneic event, it is when you're stopping breathing like that, it's 10 seconds or longer. So
Okay.
stopping 10 seconds or more is categorized as an apneic event. And when you're doing that, you're causing a lot of stress on your heart, okay? And you're depriving your body of oxygen. And that's not good.
No.
That's not good
We
at all.
need oxygen.
Yes, you definitely need oxygen.
We need oxygen. Very
You definitely
important.
need oxygen. So part of what we do at Dr. Skiller's office, or Morton Pulmonary and Sleep in Morton, is that we educate patients,
Okay.
on the consequences of not treating their sleep disorders. A lot of people don't know that they have sleep apnea. It's not one of those things where certain things happen and you're like, oh, this could be sleep apnea. They don't know that they can feel better.
I see.
you know-
They're so used to having it. They're so accustomed
Yes.
to having it. So what are some symptoms of sleep apnea?
So symptoms, there's a lot of them,
Okay.
but the most common is excessive daytime sleepiness, fatigue,
Okay.
irritability,
Yeah.
just different mood swings, behavioral issues, and stuff like
Maybe
that.
even
So,
achiness.
yeah,
Your
even
body
that
aches.
too.
Because I know when you are tired, if I don't get a good night's sleep, I can feel it.
Yes.
Like my muscles ache. I
Yes.
just don't have that get up and go.
Yeah, and it'll do that to you, And some people think it's normal to wake up at 7 o'clock in the morning, to get ready for work, and by 9 o'clock they're wanting to crash, And that's not normal, You
If
shouldn't
that's
want that.
you, that is not normal. Maybe you know someone, maybe your spouse or partner or good friend or family member, you recognize during the day that they seem excessively tired. And, even if you're stressed or you're working hard, that just really isn't normal. So keep on watching this show. Want to encourage you to do that. All right. So you're pretty experienced in this field.
Yes.
So tell us about your experience and how you landed in this sleep apnea role. Now, I know you used to work at OSF, so it kind of started there.
Yes, I started at OSF in the INI sleep lab, and that's the Illinois Neurological Institute. And it kind of, my story and how I started is, it started with my dad.
Okay.
My dad, he was 35 years old, and died of a massive heart attack.
Wow.
He was very fit, he worked out, but he also had a really big trunk, had a really thick neck.
Yeah.
It just looked like a head on top of some shoulders,
Okay.
and and have a heart attack that young, that's that's not good. So it just kind of got me thinking. The more and more I learned about sleep apnea, and the opportunity arose at OSF, and I took it, and I haven't looked back since. So
So you felt like maybe sleep apnea was contributed
Yes.
potentially to your father's early heart attack and his
Yes.
early death?
Yes, sleep apnea is actually one of the leading causes of heart attack, stroke, short-term memory loss. You can even have seizures because of it. So it affects a lot of things in the body, and the heart is one of them.
You mentioned that your dad had a big chest, a big neck. Is that a symptom? Like, what does that have to do with?
Well, it's definitely an attribute.
Okay.
So, I always tell people, because I have sleep apnea myself.
I see,
And
okay.
I wear CPAP. And when I tell patients that, they look at me and they go, "Well, you don't fit the bill
Oh,
for
you're
that."
pretty fit,
Thank
Tommy.
you, thank you. And so I tell them there is no bill.
Okay.
Yes, there are your statistical patients that have big bellies, big necks, but it doesn't discriminate, is what I like to say. Children have sleep apnea. In my experience, I put CPAP on 2-year-olds.
Really?
I've even put CPAP on an 8-month-old before.
Are you serious?
I'm very, very
so
serious.
Children. So okay, well we got to back up since I'm
Sorry,
no. I'm a mom, and since today's been a little hectic having a sick teenager and trying to get her well, as a parent, what would we look for to think that is it the same symptoms for children? Just
Yeah.
extra tired?
A lot of the same symptoms, including snoring, and excessive daytime sleepiness, fatigue, decreased activity in school, hyperactivity in children.
Yeah.
For some reason, it's kind of the opposite effect on children than adults. It causes hyperactivity.
Well, yeah, because tired kids get crazy.
Yes, yes, they do.
So it
yes.
is kind of opposite. If
Yes.
it's like a crabby toddler that doesn't get a nap, right?
Yes.
They start acting really
Yes.
bad behavior when they're tired. So
Yes.
that would make sense. So is it normal for a child to snore?
It is not normal for a child to snore.
Okay.
But I will tell you this, one of the biggest misconceptions is that just because you snore means that you have sleep apnea. And that is not the case.
Okay.
There are
Because
some
snoring
people
can
that
be
just
caused
snore.
Okay.
Yeah.
Just because, like, what really causes snoring? Just like,
Well, it happens in the airway.
Okay.
So what happens is that fatty tissue in the airway, it's almost like a partial obstruction of the airway. And so when you breathe, that tissue there in the airway it vibrates. And that's
Okay.
what causes the snoring.
Okay.
Another misconception, people think that thing that hangs down the middle of
your little
your
uvula.
uvula, they think that's what causes, because you think, in cartoons and in some movies,
yeah.
they make it look, but that's not the
Because
case.
they do make it kind of
Yes.
look like that's
Yes.
what's causing
That-
the
and that's
whole
not
Fred
it.
Flintstone,
Yeah.
snoring
Yeah.
syndrome. So, yeah, wow, that's good to know. So, but it's not necessarily normal for children to snore. So if you've got children that are snoring or seem a little extra tired, irritable during the day, can't focus, you might want to have them checked.
Yes.
All right. So what's the protocol? So what happens if someone calls your office because they're interested in finding out, or they think they may have sleep apnea? Maybe they have some of these symptoms.
So you call the office. Of course, we'll ask, if you have to be referred or not. Some insurances require that.
Okay.
But if you don't, call the office. We'll get your information in. We'll bring in for an initial consult.
Okay.
You'll talk to myself and the doctor, and we'll just go over, how are you feeling? What symptoms are you having? What
Right.
makes you feel that you might have, sleep apnea? And then from there, we'll bring you in for an overnight sleep study.
Okay. So you actually have the sleep study space in your facility.
Yes, yeah, it's a
Okay.
2-bed lab.
I don't know why, but I always have this idea like that would be really creepy trying to to sleep in a lab. So I bet some of the listeners, anyone viewing right now, might be thinking, oh, I'm a little that apprehensive about going and doing a sleep test in a lab. So
Yes.
help us feel better about that, Tommy.
So-
walk us through the whole process.
So it's kind of funny because, I've been in the field for it'll be almost 10 years now. And when I got diagnosed, I had to have a sleep study done. So when I was the one, performing the sleep studies, patients would come in and they'd be really, 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 apprehensive and kind of had reservations and nervous.
Right.
And part of my job, was to provide that ease to them and say, hey, it's no big deal. All we're doing is we're just, put some sensors on you and watching you sleep. That's all we're doing. And I went in for my sleep study and I was nervous.
And you actually do this for a living.
Yeah, and I did this for a living, but it's not as bad as a lot of people think.
Okay.
I can't tell you how many times people have, I'm never going to sleep with all this stuff on, and,
Right.
and just like that, they're out. You
When
know,
you're tired, you're tired.
when you're tired, you're tired.
When it's time to go to sleep, you can sleep anywhere, I guess.
Yes. So part of the process is you come in, and the sleep techs, they put a lot of monitoring devices on you.
Okay.
One of the major things that we do is we do EEG.
Okay.
Okay. So we monitor the brain.
All right.
Okay. And that's how we know whether you're awake, what stages of sleep you're in.
Oh, cool.
And then we also monitor your eye movements
All right.
and your muscle activity. And that helps with REM recognition.
Okay.
And for those of you that don't know what REM is, it stands for rapid eye movement.
Okay.
And that is the stage of sleeping when you dream.
Okay. And is that you? Now, I've always heard that that's the sleep you really need.
Yes, that is the sleep you need. That is the restorative stage of sleep. And so we monitor the eyes and the muscle activity, because when you do go into REM, again, the rapid eye movement, your eyes, it's real pinchy, like your eyes are constantly moving. And then we monitor the muscle activity, because when you do fall in the REM, your brain or your body releases a hormone called serotonin. Okay. And so what serotonin does is that it paralyzes your muscles while you're in REM, so you don't act out your dreams in your sleep. Otherwise, if you do, you'll have what's called a REM behavior disorder.
And that is?
That's when you act out your dreams, in your sleep.
We'll have to have another show and talk about that.
Yeah. Which could be hurtful, to either yourself, or your bed partner.
Like sleepwalk or something?
No, just kicking and flailing around, and but sleepwalking does play a role in that. Yes.
So if I've ever had a dream, I've had this dream before where I can't move.
Yeah.
Is that probably because I'm actually dreaming I'm awake even though I'm not awake, or
that's called a recurring dream. When you have the same dream over and over again, that's called what's called a recurring dream.
It's like I'm paralyzed. I'm trying to move, but I can't.
That's called sleep paralysis.
Oh,
that's
okay.
why. Yeah, then that's something for a whole another show. Too.
All right. Well, then that brings me to before I sidebar, I want to talk about the dreams, because what happens if someone doesn't dream? Let's save that question, but finish up sharing. You were saying, okay, so they get to REM sleep, the test.
Yep. So we monitor all of that, and then we also monitor respiratory. So you're going to have a belt, on your chest and on your stomach. And we always tell people, there's no wrong way to breathe, but we just want to know how you're doing it. Some people are chest breathers, some are stomach breathers. Okay.
Is there a better way?
It doesn't matter.
It doesn't matter.
It doesn't matter.
You get the same amount of oxygen. Okay.
In my experience, yes.
Okay.
I always push in my experience, because you can get 20 different people that do what I do, and it's all going to be different.
It's like fitness and nutrition,
yes,
right?
exactly. So we monitor your
opinions.
respiratory, and then we also monitor respiratory through your mouth and your nose.
Okay.
And then we monitor your leg movements for the ones that have what's called restless leg syndrome, or RLS. And then we monitor your oxygen with a pulse ox, and that's pretty much it. Some do more depending on the diagnosis.
All right.
But that's pretty much it. Just the head, the EEG, your nasal and oral breathing, your respiratory, and your legs. And a snore mic, and a snore mic too, to monitor your snore. Yes.
So then, can you hear and see all this stuff? Do you show us a video of ourselves as we sleep?
Well,
that would kind of be cool.
Yeah, we can't show you the video, but we can kind of give you a snapshot of what happened, in the morning afterwards.
Okay.
But that's what the snore mic's for. We can see and hear it at the same time.
Because some people are like, I don't snore.
Yeah, and
I bet there's a lot of wives going, show him how much.
Yes, yes, and that's the beauty of it. Sometimes when husbands or wives come in with each other, they telling each other, and it's funny to me. So
I guess women do snore too. So there's
Yes.
probably some husbands watching right now going, "Hey, my wife's the snorer."
Yeah,
not
so
me."
women do snore, not as much as men do, but they do it.
Yeah, well, and that's because shows like I always think of Fred Flintstone when it comes to the snoring, right? Because he's like the epitome of a snorer.
Yeah, when I see that, I seem like he's probably got sleep apnea.
Fred Flintstone had sleep apnea.
Yeah.
All right, so you piqued my curiosity when you said. You talked about getting to the dream sleeping,
Yes.
REM sleeping, and that's the restorative stage
Yes.
of sleep. And that's when the melatonin
Yes.
is, or serotonin.
Serotonin, yes,
sorry,
yes.
not melatonin. Serotonin is produced in your body. And so what is it about some people? I dream often.
Right.
Like I'm pretty sure I dream every single night, mostly in the morning right before I wake up.
Mm-hmm.
And I can almost always remember my dreams vividly.
Okay.
My husband says he never dreams.
Well, he does.
Okay.
We all dream every night. We just don't remember them. So in the sleep world, they say that 75% of dreams are not remembered.
Okay.
Usually you remember your dreams as you're waking up out of that REM cycle.
Okay.
So that's when you remember. Now our bodies usually go through between 4 to 6 REM cycles a night.
Okay.
Each one lasting longer than the previous one. So at the end of the morning when you're waking up, you've reached that last REM cycle, which will probably last about 45 minutes to an hour, sometimes an hour and a half. It depends.
Well, that's what I was going to ask you. So you go through 4 or 5 cycles of REM, you said?
About 4 to
and
5
each
REM
one
cycles.
lasts how long?
Longer than the previous one. So the first one might last 20 minutes.
Okay.
The next one 35 minutes. And the
Okay.
next one 40. And your last REM cycle usually lasts between 45 minutes to an hour.
Okay, so you need that REM sleep.
You definitely need that
and
REM
that
sleep.
is an issue when you have sleep apnea.
Yes. So what happens is that your body is actually depriving you of certain stages of sleep, of deep stages of sleep.
Okay.
And so a lot of people with sleep apnea, they're constantly like their body's so deprived that in any chance that their body thinks it has downtime, it's going to take it. And that can be either on the road while you're driving.
Oh, wow. So like people
while
who
you're
fall
at
asleep
work.
driving, yeah.
Yes, while you're at work. Anywhere. And like you, my brother-in-law, is a prime example.
I remember. I want you to share that story because that was one that was really emotional for you too.
Yeah, it was.
And so share. That's a great success story. So share.
Yes.
I know the listeners would love to hear that.
So my brother-in-law, he reached out to me and said, hey, I really need to get this done. And I've been on him for years about getting it done, because he's a big guy. He's tall, he's big. And so he finally decided to do it because he got tired of being tired. Is really what it was.
That's pretty much happens.
And so he came in for an overnight study. And at that time, I wasn't doing, night studies anymore. I was working during the day, but he wanted me to do it. So I did.
Right.
And I mean, he had severe sleep apnea. Probably one of the worst I've seen. He stopped breathing 120 times an hour.
What?
Yes.
120
He stopped
times
breathing
in an hour?
120 times an hour. And so I did what's called a split night. So within 2 hours of sleep, I came in, and I put the CPAP mask on him, to try to eliminate that and help him breathe better.
Wow.
And I succeeded. And he woke up the next morning and just, he didn't know what was going on, and he just kind of looked around and he looked at me. He goes, what happened? And I was like,
because he slept.
Yeah, he slept. He was alert. He had energy. We joked because he's like, I folded laundry. It's like, how long it's been since I folded laundry. He actually started losing weight just from wearing the CPAP alone because he had
Right.
more energy and he was alert.
Moving more.
Yes, so that was a really, really big success story for me, and I was very happy to help him out because he was bad.
That is amazing.
Yeah.
So, yeah, I mean, and, I love that story. I love those success stories. I hope it encourages you, if you're listening, if you think for even a minute that maybe you have some of these symptoms of sleep apnea and you just want to check it out. Does a lot of insurance cover if you just need to be tested to verify? Is that something that usually insurance will help out with because
Yes.
there's so many medical
Yes.
issues that come along with sleep apnea if you
Right.
don't get it checked out?
Yes, at least at least in our office, the insurances that we deal with, which are Medicare and commercial,
Right.
they will cover it. Some may require pre-authorization, some don't.
Like from a regular doctor? or
yes, yeah.
Whatever. But
Yeah, or just a call from our office to say, hey, this patient needs this, and that they may request paperwork or documentation. Some don't. Some make it very easy, some make it kind of difficult. But
all insurances are a little different.
Yes.
But it's worthy of having the test.
it's definitely worth
And
it.
it's not scary. You're going to get to see this cool guy here, Tommy. And he's really awesome. And what
Thank
I
you.
love and what I always love about all my guests that come on the show, Tommy, is your passion.
Yes,
I never met somebody so passionate about sleep apnea.
I am. It's really nice. There's no better feeling than seeing the difference that myself and the doctor can make in these people's lives. We're basically giving people their lives back and helping
Yeah.
them take control of their health instead of their health taking control
Right.
of them. And it's a really big deal. Sleep apnea is real. I'm going to give you this staggering statistic here. But in 2015, there was a study that was done, and it showed that the economic burden of undiagnosed sleep apnea, in the United States, it was $150 billion.
Oh, dear.
And I'm going to break those numbers down.
$150 billion.
Yeah, and
Okay.
and break those numbers down real quick. So 86.9 or 87 billion was in lost productivity. 30 billion was in comorbid diseases, okay, alongside of sleep apnea. 26.2 billion were in motor vehicle accidents, and then 6.5 billion in workplace accidents.
Wow.
So it's real.
It's
a real
real and
thing.
it's very serious.
Yes, some people think it's a scam. I've heard so much. Oh,
Are
it's
you
a scam. Oh
serious?
my goodness. When it comes to CPAP, they come in, with these issues and symptoms, and we try to provide them with the, not say the cure, but with the something that'll help them, the
Assistance to
assistance
help.
for it, and nah, I don't want it, and it throws you for a loop. It's just like, okay, but you do know that you could have this, and this with that,
Right.
and they don't want it, and it's kind of
It's interesting because sometimes I feel like it's a cop out. Sometimes people are like, well, it's almost like they don't want to get well.
yeah.
I've always, there's this one little scripture in the Bible where Jesus is about to heal someone, and he asks the guy, do you want to get well?
Yes.
And I always find that an interesting question.
Yeah.
And it's like, would he have said no?
What would that? Yeah.
But I do think that sometimes people, they get so used to living their life of that enablement
Yep.
that they don't really necessarily have that deep desire to get well.
Yeah, it usually happens when something happens, and when it scares them, and then they're like, oh, okay, well, I want to get
Then
this
it's
done.
extreme.
And sometimes it might be too late. So we try to reach out to those people and say, hey, this really really works. And I tell all my patients that I've ever encountered with CPAP, it only works if you want it to. As of right now, it's the gold standard in treatment, for sleep apnea.
Right.
And for those who don't know what CPAP is, it stands for continuous positive airway pressure.
Right.
Okay. And so what it is, it's pressurized air that's being pushed down your airway and keeps your airway open so you can breathe correctly. For those, I tell people it only works if you want it to. If you don't want it to work, then if you fight with
Well, you
CPAP,
gotta
it's going to
wear
win
it.
every time.
If you don't wear the CPAP,
Yes.
so it presses the air down your airwaves. So going back to what is sleep apnea?
Right.
Okay, so maybe someone's just tuning in live right now.
Okay.
So I'd like to go over that one more time. So is it because your airwaves are kind of closing off when you're sleeping?
So what it is, it's the fatty tissue in your airway that collapses on the airway. So like your palate, collapses on the airway.
Okay.
And so when it does that, so quick process of how it works. So when you stop breathing, the carbon dioxide in your blood builds up. Okay. The chemoreceptors in your blood vessels are like, wait a minute, that's not right.
Right.
So it kind of tells the brain, hey, something's not right here. And so your brain kind of sends a jolt to the body, that arouses you, enough to resume normal breathing. And when you're doing that, you're causing stress in your heart.
Sure.
Within your body releases stress hormones to try to help with that.
Absolutely.
And when it does that, it actually increases your heart rate and therefore increases your chance of heart failure.
Yeah, because it puts you probably in a fight or flight situation a lot of times.
That's one of the terms that we use in the sleep world. It kind of gives that fight or flight. Yeah.
And that triggers your immune system as well.
It does trigger, yes.
And that can cause inflammation.
Triggers a lot of things. It does. It triggers a lot of things, and people just don't. I think as much awareness as we're putting out there I still think there needs to be more.
Right.
Because certain things, like someone can have a heart attack or a stroke, and sleep apnea isn't the first thing that they think of.
But it could be, like you
and it
said,
could
with
be
your
it.
dad, you really,
Yeah.
once you learned about sleep apnea, because he died so young.
Yes,
35,
very, yeah,
you said?
35, yeah.
And so when you started learning about sleep apnea, then you realized that could have been a huge contributing factor to his
Yes.
early heart attack.
Yes.
That's absolutely amazing. Okay, so you got to get checked. You got to find out if you do or not do. I mean, if I had any symptom whatsoever, I would have this test.
And that's what I
even
did.
though it is a little awkward, I think, to go and have sleep tests done in a lab, how long would someone need to be there? Like, how many hours of sleep do you need to test them to get a good reading?
Between 6 to 8.
Okay, so it's not like a short, you come take a 3-hour nap and you can
No,
go.
it's not.
It
No, it's
really
not
is
like
like
that. Yeah. We need
okay,
time
I was
to.
trying.
Yeah, a good try though. But yeah, we need time to evaluate, and really see what's going on.
Yeah.
Because a lot of people's apnea doesn't really show up until they hit REM. Because everything's so relaxed, the muscles are relaxed.
Right.
So those are what we call REM related.
All right.
So when they're in their just regular stages of sleep, they look fine, but when they hit REM, that's when kind of everything all goes to.
So it kind of collapses down on those airwaves, and you then aren't breathing, and
Right.
so then your body jolts itself and wakes up because your body goes, "Hey, we need oxygen."
Yes.
And the CPAP machine, that is what you said, the state-of-the-art treatment at this point in time for sleep apnea.
Yes.
Forces that air down your airway so that
Yep.
it can't collapse then.
Yes.
You won't stop breathing.
Right. You breathe normally and correctly.
I don't think I think I'm more afraid of not breathing while I'm sleeping than I would
Yeah.
be of coming and having the test done.
Right. I'm sorry. Go ahead.
No, you go ahead.
I've come across patients that have beards, and they're mouth breathers, and they need what's called a full face mask.
Okay.
And some have refused it. And I'm like, okay, well, that's totally up to you. But what would you rather have? A
Right.
beard or a heart attack,
Right.
or a stroke? And some they'll stick to it. I haven't shaved since I was 16 years old.
Like they got some kind of, like their beard's their idol or something.
Yeah,
They got
like,
some kind of weird attachment to it.
It comes
It's
down
like
to
a Lucky
priorities.
Charm.
Yeah. So it comes down to priorities and what's important to you.
Yeah, because sleep is important.
Yes.
I mean, we talk about health every week on Healthy You, and it is our priority on this show to give you information to help make living a healthy lifestyle a little bit easier. 60% of Americans are overweight.
Yes.
And it's causing real issues here, real issues. And we want to help you get that weight off, get healthy, start exercising, have energy, and above all, sleep well.
Yes.
Because, I'm an exercise and nutrition enthusiast and an expert in that area. But I know one thing. If you're not sleeping and you're tired, you're not going to exercise.
Yep.
You're not going to exercise, and chances are you're going to need some comfort food. Right?
Yes,
A
I've been
healthy
there.
Yeah, you're going to
think I'm
want.
still there.
Yeah, right. You're going to need some comfort food because you feel tired and you feel exhausted, and your body's like, you need something to make you feel better. And so it goes to, oh, I know what makes you feel better.
Yeah.
A big bowl of cheesy potato bacon soup. For some reason,
You're enabling right now. I hope you know.
Yeah, salads don't sound good when you're tired, unfortunately. But when you're, have energy from a good night's sleep, you're more apt to get the things done and make better choices.
Yes.
All right. In the last minute here, just share with them how they can reach out to you guys and contact you and get your appointment scheduled to have their sleep apnea test. How can they reach you?
So we're in Morton, Illinois. Our address is 652 West Jackson Street. We're in that plaza. We're at the corner where Great Harvest Bread is. We're the last one in that plaza.
Okay.
Right by Zeller Electric. And our phone number is 309-266-8880. So give us a call.
Yeah.
And we'll get you scheduled and we'll get you in here.
Yeah, and we'll go back on the show and comment that information as well. Maybe post a link for your website or something like that. We love for you to ask questions. So if you have any questions about this test or any questions about sleep apnea, post that in the comments. And later on today or tomorrow, here in the next little while, Tommy I'll share that with him, and he'll get on there and answer some of those questions if he can for you. I'm sure you can. You've been doing this for a long time.
Yes.
It's really cool stuff.
It is.
I hope you decide to come on the show with us again. I think you got a lot of information. I want to learn more about those other things that we were like, that's a whole nother show in itself.
Yeah.
All right. Awesome. Hey, guys, sorry we were late today. Thank you for your patience. Enjoy the rest of your Wednesday, and we'll be back next week.
Thank you. See you later.
Awesome. Yeah, that's a very interesting.